Hello, I'm Kristine Batty, a nurse practitioner, board certified in advanced diabetes management, and a certified diabetes care and education specialist. I'm also a person living with type 1 diabetes for over 40 years. My dual perspective allows me to bridge the gap between clinical expertise and real-world experience. As a provider, I understand the science behind diabetes management. But as someone who wears the tech, I know the daily challenges firsthand. Today's topic is breaking down diabetes technology barriers. We will be discussing how to overcome the physical and emotional barriers to diabetes technology use. Understandably, there is often an emotional barrier that can be associated with continuous glucose monitoring and insulin pumps. As a person with diabetes, I remember getting my first insulin pump. My endocrinologist said, an insulin pump is going to be best for you, but I really need you to go home and have a conversation with your spouse. This is going to be attached to you all of the time. I thought, really? Attached all of the time? What will people think if they see it? Is this really my best option? My concerns were not uncommon. Here are some other ones that your patients might have. What if I go to the beach or go swimming? Can it get wet? I played football. Can I wear the device during the game? What if it falls off? Then what? So how do we help our patients overcome their concerns about these on-body devices? First, as always, you have to ask the person about their lifestyle, their hobbies, and their daily activities. The more you know, the easier it is to address their specific worries. Talk about individuals who successfully use these devices every day. This year, both Super Bowl teams had players who used CGMs and pumps. In fact, almost every major sport has players who do the same. If they can do it, you can too. I discussed that these devices are used early in treatment and are not their end of the road in treatment, and can prevent the complications of diabetes. Now let's discuss the what will people think scenario. There is a lot of stigma about diabetes in the world. You didn't eat well, so you got diabetes, or you're on insulin, you must not take care of yourself. Many people don't want to wear devices because it's announcing that they have diabetes. They'll see that thing on my arm and they'll know I have diabetes. That is an absolute legitimate concern. As a medical provider, you have to listen to what your patient is saying. I don't want to be attached to something because I won't be able to travel ever again. I will feel like a failure since it's the last resort. We need to listen to those statements. Drill down and get specific. Tell me more about your lifestyle. Don't let the person compare themselves to another person who's wearing these devices. We are all individuals with diabetes, and we need to make sure that our treatment is for us and not for somebody else. Perhaps a trial period is in order. Use a sample or professional CGM or a trial of an insulin pump. That way the person with diabetes can see what it feels like. It may not be as bad as they think, or maybe it just proves that it is not for them. 3 takeaways. Number 1, there are several reasons people may not want to use diabetes technology. These include wearing something all of the time, feeling like it's the end of the road in treatment, and diabetes stigma. Number 2, have a discussion about the person with diabetes lifestyle, technology myths, and expectations about technology use. Number 3, consider trials of tech devices to determine if it is or is not acceptable to the person with diabetes. For more on this topic and other diabetes technology topics, please visit danatech.org from ADCES.